Good morning, students. Today I discuss the parietal bone. There are two parietal bones situated between the frontal, in front of frontal bone, and behind the occipital bones of the skulls. There are two surfaces, outer surface or external surface, inner surface or internal surface. The shape of the bone is quadrangular and flat bone. There is four border: superior border or sagittal border, anterior border or frontal border, posterior border or occipital border, inferior border or squamosal border. Inferior border is squamosal border. Now there is four angle. This is the antero-superior angle, that is called frontal angle. Antero-inferior angle, that is the sphenoidal angle. Posterior-superior angle, that is the occipital angle. Posterior-inferior angle is called mastoid angle. Now how to the side determinations. The superior border is above and serrated in middle inside and above. So above and middle. The external surface is convex. Inferior border is arch and antero-inferior or sphenoidal angle is acute. Now the external surface. External surface have convex and prominent part is called parietal tuberosity, parietal eminence or parietal tuber. The some importance of the tubercle or tuberosity. The important landmark of the parietal bone. It corresponds to the maximum diameter of the transverse diameter of the skull. The upper end of the posterior ramus of the lateral sulcus of the cerebellar hemisphere. The opposite side, the center for the written and printed words. These are the opposite sides. The center of the first started these points. Ossification is started from this point. The started ossification is 7th week of intrauterine life. There is two primary center, one just above the line and one below the line, and both are fused. There is one thick line. They are divided by superior and inferior. The thick line, superior temporal line, below the inferior temporal line. Superior temporal lines originate of the temporalis fossa, and below the inferior border of the temporal line is temporalis muscles. The temporalis fossa is fused with the glia aponeurotica. In parietal sides, external side, there is one parietal foramen that transmit the imaginary veins and occipital veins and small branches of the occipital artery. Now coming to the internal surface or cerebellar surface, is deep and concave. Deep and concave. The sagittal sulcus. There is one sulcus is a sagittal sulcus. Longitudinal silo grooves of the superior sagittal border with similar groove opposite side the bone from the sagittal sulcus. And lodges the superior sagittal sinus. The margin of the sulcus give origin of or attachment the dura, that is called the falx cerebri. The posterior sides and superior sides parietal sulcus. The some depression part that is called the granular fovula. In the irregular pits, like all are irregular pits or sides. The lodges of the arachnoid granulation. The group 4 branches of middle meningeal. The group 4 branches of the middle meningeal vessels. Anterior branches begin at the near the antero-inferior angle, and posterior are the close to the distance of the posterior inferior angle. The posterior inferior angle is called the sigmoid sinus, and all are the impression of the middle meningeal gyri. The superior border or sagittal border articulate with the other parietal bone. Inferior border or a squamous border, they are divided into 3 parts: anterior part, intermediate part, and posterior part. Anterior part, the outer surface articulate with the sphenoid of the great wing of sphenoid bone. The intermediate part articulate with the squamous part of the temporal bone, and posterior part is articulate with the mastoid part of the temporal bone. The anterior border or frontal border, the inner surface and outer surface both are articulate with the frontal bone. The suture is called coronal suture. The posterior sides articulate with the 2 parietal and lateral part of the occipital bone. The sutures form is called rhomboid sutures, and 2 meeting points or junction of 2 parietal and 1 occipital, the junction is called lambda. Same thing in anterior sides. The 2 parietal bone, 1 frontal bone, coronal sutures, the junction between that area is called bregma, and this is called also anterior superior or frontal angle, and bregma is also called anterior fontanelle in infant, and posterior lambda is called posterior fontanelle in infant. The lower side antero-inferior, there is pterion, is formed by 4 bone. Parietal bone is a squamous part of the parietal bone. Frontal bone, temporal bone, squamous part of the temporal bone, and greater wing of sphenoid. There is 8 separate sutures is called pterion. Same thing in posterior side. 1 sutures around the posterior side is formed by parietal bone, occipital bone, and mastoid part of the temporal bone is called pterion. Some important of the pterion, the opposite this point, the anterior division of middle meningeal artery, then opposite the line division stem the lateral sulcus of the cerebral hemisphere into the 3 rami, and inner sides some area that is called Broca's area, there, that is the motor speech area, around this. Some clinical importance of the parietal bone is epidural hematoma, the most common cause of the fracture of the parietal bone or temporal bone. Most fracture of the parietal bone and temporal bone. In this injury, the middle meningeal vessels may be torn or hematoma, or may be arterial or venous. The artery bleed is rapid and symptom of the brain compress generally occur within the 3 hours. The hematoma is a most surgical emergency case. During hematoma, some compression of the brain and immediate craniotomy should be done. And this hematoma is called or known as talc and dye syndromes. That's about the parietal bone. Thank you.